my name is Eliana Kim, and I am a rising senior at the School of Advanced Studies at North Hollywood High. Today, I'll be talking about a fascinating and potentially life-saving research study focused on improving outcomes for premature infants. The project centers on a method called neuromodulation of proprioceptive afferents, or vibration on the limbs to reduce a serious condition known as apnea of prematurity, and subsequent hypoxia and bradycardia. But first, here's a little bit about me. Once again, my name is Eliana Kim, and I'm a rising senior from California and an aspiring pediatrician or neonatologist. I'm passionate about community work, serving as president of Bridge at the Koreatown Youth Community Center, founder of Sending Sunshine at NHHS, which combats senior loneliness through card writing and decorating, and president of our UNICEF USA chapter. This summer, I'm also a co-associate at the Think Neuro Research Internship, leading a group research project studying CSF biomarkers in autism detection. I also tutor K-4 students part-time. Outside of academics, I'm captain of the GK96 Archery Club, competing at a regional, state, and national level. I'm also a pianist with 4 state honors from the Music Teachers Association of California. Before we dive into the exact research conducted, however, I want to quickly clarify what the field of neonatology is about. Neonatology is a branch of pediatrics that deals with medical care of newborn infants, especially those who are ill or born prematurely. Premature babies, those born at least 3 weeks early, often have underdeveloped lungs, brains, and immune systems, which means they almost always require special care in the neonatal intensive care unit, or NICU. Prematurity is actually the leading cause of death in children under 5 years old worldwide. So any innovation that helps us better care for these infants could potentially save thousands of young lives. The objective of the study I'm presenting today was to test whether neuromodulation, in this case, gentle vibrations targeting proprioceptive nerves in the limbs, could reduce 3 major conditions in premature infants: apnea of prematurity, hypoxia, and bradycardia. To break it down once again, one of the most dangerous complications of prematurity is something called apnea of prematurity, something I'll refer to as AOP. This is when a premature baby stops breathing for 20 to 45 seconds during sleep. These pauses can lead to hypoxia, when the body doesn't get enough oxygen, and bradycardia, an abnormally slow heart rate. In serious cases, this can even lead to long-term brain damage and developmental delays. These 4 graphs on the right show a full picture of what happens during an apnea episode. In panel A, we see a 13-second breathing pause. That's the apnea event. In panel B, as a result of the pause, the infant's oxygen saturation drops, a condition called desaturation or hypoxia. In panel C, you can see the heart's electrical activity flatten slightly. And in panel D, that same event results in bradycardia, where the infant's heart rate drops significantly below the normal range. This cascade from apnea to hypoxia to bradycardia is exactly what the researchers are trying to prevent. Here's a visual comparison. The brain scan at the top shows a premature infant with an underdeveloped brainstem and cerebellum, which are critical for regulating breathing. The lower image is a fetus at 34 weeks, still not full term, but significantly more developed. These subtle differences are a part of what makes preemies so vulnerable to AOP. The research process itself was as follows. First, the team recruited infants born between 23 to 34 weeks, already diagnosed with AOP. Small vibrating discs were then attached to one hand and one foot. These stimulated proprioceptive afferents, nerves that sense movement and position, sending signals to the brainstem to support breathing rhythm. The devices were then turned on and off in 6-hour intervals over a 24-hour period. This helped the researchers compare breathing patterns during stimulation versus not. Throughout the trial, they tracked 3 key indicators: heart rate, oxygen levels, and number of breathing pauses, and compared the number and severity of these different episodes. This graph shows breathing patterns over 60 seconds in the same premature infant, once without stimulation on the left and once with stimulation on the right. In the first panel labeled A, you can see 4 large dips marked by arrows. These are the breathing pauses. In contrast, in panel B, when proprioceptive stimulation was applied, the breathing pattern is much more consistent with no major pauses. Neuromodulation's clinical benefits become especially evident when visualizing the data in the graphs presented here. Comparative graphs of breathing pauses, oxygen desaturations, and bradycardic episodes consistently show the STIM group, or the neuromodulated group, with significantly reduced frequency and duration compared to controls. Side-by-side bar charts reveal the STIM condition consistently outperforming baseline, with p less than 0.001 for all metrics. These results demonstrate neuromodulation's capacity to disrupt the apnea-hypoxia-bradycardia triad in premature infants, reducing event frequency by over half while improving physiological stability. This is a big deal. Prior to this study, the most common treatment for AOP was giving the babies caffeine to stimulate brain activity and subsequent breathing. However, caffeine comes with side effects like irritability, sleep problems, and feeding intolerance, and it's not always easy to dose correctly in tiny infants. Plus, it's still a drug, and many families or hospitals prefer treatments with fewer medical risks. Therefore, neuromodulation is important because it is minimally invasive in this sense. How is this such a global health-related breakthrough, though? Let me quickly read you some statistics. 10.4% of all babies are born prematurely. 85% of premature babies develop apnea of prematurity. 17.7% of child deaths under age 5 are caused by prematurity complications, often as a result of AOP. 80% of preterm births also happen in middle and low-income countries, and most of the time, they don't have easy access to infant healthcare benefits. That is why neuromodulation method is important, not only because it's non-invasive or in the less expensive side, but because all these benefits combined can drastically decrease child mortality everywhere in the future. I would like to take this time now to acknowledge the following professors: Dr. Kalpashri Kesavan, Dr. Paul Frank, who I was unfortunately unable to find a picture of, Dr. Daniela M. Cordero, Dr. Payman Benaraj, and Dr. Ronald M. Harper. Dr. Kesavan, one of the leading professors in this clinical experiment, actually was able to get back to me through email and was able to clarify a lot of my questions based on the field of neonatology and her work in this experiment. That was an amazing experience, and I would like to give a big thank you to her as well. These links are the references that I used to conduct my research. Once again, my name is Eliana Kim, and feel free to reach out and contact me on any of these platforms. My email and my LinkedIn are attached below. Thank you so much for listening.